Maheer, dentures versus implants, what do you reckon?
So dentures are good, they're cheap. Yeah, they're really quick. Usually we just take a mold, we take a scan now, make these dentures, we 3D print them sometimes. Easy replacement for a tooth, right? So cheap as well.
Yeah,
But, yeah,
can you eat hard foods?
no, very well. I mean, sometimes you can. It depends on a few things. Depends how much bone you have, how many teeth you got left. But those full dentures, they cover your whole palate, right? So they're rocking around. They can slide around, especially those bottom ones. They never stay in place.
Like, to me, we still do dentures, okay? They're cheap. I think that's the main reason we do them. Cheap, or if you've got health conditions that prevent doing implants. The implants are so much better because it's not going to move around. My problem with dentures is that people are just never happy with them.
Yeah. I mean, I remember in uni, we had a professor and he told us the quickest way to lose your teeth or your patient's teeth is to give them a denture. And that's because we're using maybe a couple of teeth to take all the forces, all the load of a whole mouth, all the teeth. And it's a couple of teeth, they're basically copying it. And we find they just get loose and they eventually fall out even.
I think there's rare occasions when partial dentures work pretty well, okay? And especially if they're made well, you can make them pretty functional. It just doesn't compare to like the improvement in quality of life that we get with implants.
Exactly. Never having to take your teeth out. Teeth that look like teeth, they almost feel like teeth, as opposed to a big chunk of plastic in your mouth. Or if you're lucky, you have a little bit of metal at least. Yeah. It's not the same experience, is it?
I think the best description I ever heard from a professor describing dentures was, it's like a wooden leg. It's never going to feel a part of you. Okay, whereas with implants, because they're anchored in the jaw, it just feels like natural teeth, essentially.
Exactly. It's a couple of differences though, right? We've got to really keep those implants clean.
Yeah,
not like teeth.
Implants can get gum disease just like teeth. If you've lost your teeth from, poor hygiene, lack of care, then if you're going to spend money on implants, you've got to make sure that your hygiene is impeccable, right?
Yeah. But implants are not cheap, right? So how can you run us through some of the costs involved?
So for a full mouth of implants, top jaw, bottom jaw, for teeth that are fully secured, you're looking anywhere from $50,000 to $60,000. So it is a really, really expensive treatment compared to a denture, which you might be looking at $3,000 to $5,000 to do.
Exactly.
So I think dentures still have their place. It's still a valid treatment option. It helps fit into the budget of a lot of people. But if you do have the ability to spend money on implants, you're going to get a much better improvement in your quality of life.
And those big costs and the downside of dentures, that's why we're so into preventative dentistry. If we don't even have to use these options and we can just save teeth and keep the bite and keep the smile, that's the best thing, right?
I think one of the key things with implants, in a lot of cases, you really only get one shot at it. Especially if there's a lack of bone to begin with and we put implants in, and if they're done poorly and those implants fail, we lose a lot of bone. So then the patient's only option often is a denture. I think that's when people ask about the cost. Why is the cost so high? Well, it's a difficult procedure and it has to be done impeccably. We want this to last for, as long as humanly possible. As soon as we start cutting costs, those success rates, the predictability, it goes down a lot. So unfortunately, if you want it done well and you want it done in a way that's going to last for a long time, you do need to spend the money.
Exactly. And they come with risks and there's surgery involved, which means there's a possibility of infections, and it's not like a simple crown where it's quite straightforward.
And that's a really good point, because even if you say can't do implants for health reasons, you might be on medications that prevent surgery, you might have medical conditions that prevent it. In those cases, obviously denture is going to be our only option, and we're going to do everything we can to make sure we make a wicked denture, of course. But it still doesn't compare.
It doesn't. And most of the bottom dentures, the dentures for the bottom arch or the bottom jaw are made, most of my patients don't like it and they just can't get used to it.
Yeah, I'm more comfortable making a top denture, and if a patient really wants to cut cost and do as little implants as possible, the lower jaw is always the problem with dentures. I've never seen anyone with a lower denture that they're happy with. You can't get suction, they move around, the tongue's there. Lower dentures suck. And if money's an issue, then we usually look at saying, well, look, I'm relatively confident making a pretty good top denture. Top dentures are much easier to get suction on. It's the bottom dentures that are the problem.
But the downside of that top denture is it covers the roof of your mouth. And we know there's lots of taste buds there, especially all our the spicy taste buds. They all sit on the roof of your mouth. So a lot of my patients say, I can't taste my favorite food anymore. Yeah, because their whole mouth's covered up.
Exactly, and people describe it where it covers the palate as feeling like they've got toffee in the top of their mouth, stuck there always, It's crazy.
So if you're unsure about which option's better for you and you'd like to have a chat about it, come down to Azure Dental. Myself and Dr. Tim would love to help you out.